We are looking at part 2 of an IEP for students with reading disability, and we're looking at the parts of an IEP. We'll be going over all 4 of these parts, but this one will focus on part 1, present level of academic achievement and functional performance, otherwise known as PLAAFP, or present level of academic performance, determined by a variety of objective and current assessments in order to provide some sort of baseline data. It needs to be quantitative data that can be measured. It can be test scores, but it does not have to be. In terms of reading, I need to see some reading level or percentile ranking for some sense of comparison. It's meaningless to present just a score out of any meaningful context. So on the IEP, present level of academic functioning performance, I need to see a reading level for reading or percentile ranking that gives me some sense of context. Also on the IEP, we need to identify students' strengths, what the student can do so we can build on that, and needs show how the disability affects involvement in a gen ed curriculum and how it affects their progress. However, and this is lacking on most of the IEPs that I see at the Capstone Literacy Center, must have some sort of diagnostic assessment, like the qualitative reading inventory or an informal reading inventory or MIS-Q analysis of some sort. Simply giving standardized test scores is not adequate to diagnose a reading disability. Simply saying 77% or 56th percentile or reading level doesn't tell me the cause of the reading disability. There are 3 causes: deficits in word identification, fluency, and comprehension. We'll be coming back to these 3 things. It's important that I know these so that I can plan. All reading disabilities are not the same. And we can't have a measurable annual goal if we don't know what to measure. For example, if the student has trouble related to comprehension, we need to have measures related specifically to comprehension, not these other 2 things. So, part 3, I'm going to talk about the diagnostic assessment called the qualitative reading inventory.